I'm Dr. James Webb, and at the Osteoporosis Institute, our mission is to help patients improve their quality of life and to help patients find freedom from pain without surgery or narcotics. If you or a loved one has osteoporosis, you may have severe pain from an undiagnosed vertebral compression fracture. I specialize in a procedure called kyphoplasty, which treats acute compression fractures of the vertebrae in patients with osteoporosis. These are spine fractures and extremely painful, but fortunately for patients, the procedure is highly effective with over 90% success rate. Unfortunately, most physicians out there trained in an era before this wonderful technology was available. I frequently find that patients come to me with vertebral compression fractures that have not been diagnosed. Or worse yet, the fracture was diagnosed, however, the patient's physician told them that there was nothing that could be done about it. Also, I see many patients who have had invasive spine surgery and still have their lower back pain symptoms. Of these patients, many of them end up having an undiagnosed vertebral compression fracture higher in the spine. An often overlooked aspect of chronic pain, particularly in patients with osteoporosis, is depression. When it hurts to move because you have a painful spinal fracture, it's difficult to do the things that you enjoy and that provide fulfillment in your life. Whether that's going to church, enjoying a dinner out with your spouse, or just socializing with friends. At the Osteoporosis Institute, we work hard to try to remove the pain from your back so that you can have an improved quality of life and get back to doing those things that make you, you. One thing that separates my practice from other physicians is that I'm an expert in kyphoplasty. I've performed thousands of these procedures. I know the potential complications and how to avoid them. And also I teach other physicians from around the country how to perform kyphoplasty regularly. Another level of expertise you'll find at the Osteoporosis Center is rather than just treating the painful vertebral compression fractures, we actually manage the underlying disease process of osteoporosis to try to reduce the risk of future fractures for the patient. Many of the patients at the Osteoporosis Institute come to see us purely for diagnostic or medical management reasons. But for those patients who need a procedure to help with their pain, we offer significant advantage over many competitors. Oftentimes I'll see people advertise minimally invasive surgery, but when they get to go have the procedure, it's actually just as invasive as traditional surgery. If you're going to have a procedure done with me, the procedure is going to be done through a minimal incision, this size at most. And we're going to use just a needle that goes straight to the target area to relieve pain, without causing a lot of tissue damage and spreading open the wound. When I was trained doing kyphoplasty, we almost exclusively used IV sedation. When I came to Tulsa, I was kind of horrified that most of the patients seemed to get general anesthesia. Now there can be reasons patients need that. For the most part, however, it only increases the risk and usually prolongs the recovery time for patients. Affordability is a huge issue for patients in this economy. And frequently, if we do a procedure in the hospital on a patient, sometimes at the follow-up appointment, they may come to me and say, "Hey doctor, I got this huge bill from the hospital, $4,000 or $5,000 sometimes, just for their small portion that they have to pay, because Medicare usually pays the rest." So we do procedures in the office setting, and the overall cost is lower, so their portion is much smaller. And by the way, these procedures are covered by Medicare. Call the Osteoporosis Institute now, or look me up online, Dr. James Webb, Tulsa, to realize a reduction in pain and improve quality of life.